Doctors and nurses working in primary healthcare have an ideal opportunity to ask and advise their patients about their drinking. We have set up the SCALA project to see how we could help nurses and doctors in 3 countries increase the number of patients that they ask and advise. In Bogota in Colombia, in Mexico City in Mexico, and in Lima, Peru. What we know from previous studies is that providing training helps nurses and doctors ask and advise more patients. We also know that doctors and nurses find it much easier to do this work if they feel supported by their local communities. So in the SCALA project, we had 3 groups of providers. One group were working in primary healthcare centres where they got no training and no local support. Another group were working in primary healthcare centres where they got training. And a third group were working in primary healthcare centres where they got training and local support. Throughout the project, we kept in touch with the nurses and doctors to learn about their experiences and always to see how over time the project could be made easier and better for them.
In the SCALA study, we have analyzed data that we collected prior to the COVID-19 pandemic, as well as throughout the complete 2-year study period. In both of these study periods, we found that training primary healthcare providers was strongly linked to higher rates of asking and advising about alcohol and depression in all 3 Latin American countries. Just to illustrate the effect of training, we collected more than 20,000 alcohol measurements throughout the study period, and an impressive 98% of these measurements were performed by trained providers. In addition to this training, we also implemented a local municipal level support system in some study arms, and this included community advisory boards, public advertisements, and several events. In 2 study arms that received the support systems, 80% of all the alcohol measurements were performed by the providers. While these figures actually suggest that the support system was successful, we did not find any statistically significant effect. We must note, however, that the complete implementation of all the municipal activities in SCALA was not possible due to COVID-19 pandemic and the related restrictions. But we believe that if the support system would have been implemented as planned, the providers would have engaged in even more conversations on alcohol and depression with their patients, and the result and the effect of the municipal support system would also have been statistically significant.
As part of SCALA process evaluation, we surveyed the participating providers at the beginning of the project, asking about their attitudes and their perception of the organizational context in the primary healthcare centers they work in. Then we looked at the extent to which these characteristics were associated with the providers measuring the patient's alcohol consumption in the first 5 months of the implementation period, so before the start of the pandemic. We found that higher self-efficacy, so how easy the providers found it to ask about alcohol consumption, was associated with an increase in the proportion of the patients with their alcohol consumption measured, but only among the providers in Mexico. This may be because of the already established practice of asking about alcohol, as the official standards require the providers to include information on patients' alcohol consumption in their medical history. Next, in all 3 countries, the perceived support from the organizational leaders also appeared to significantly improve the measurement rates, but only in the non-control arms, meaning that supportive leadership can further enhance effects of the implementation strategies, such as training or municipal action. Some other factors that facilitated the alcohol measurement practice were having short and simple materials available, the measurement task being a good fit for the professional's role within the country health system, and patient characteristics. For example, whether there was a previously established relationship between the provider and the patient.
In SCALA, we have demonstrated that providing training of primary healthcare providers and by delivering local support, more patients are asked and advised about their alcohol consumption. The SCALA is in an ideal opportunity to be scaled up and implemented in other municipal areas, in other cities, and indeed in other countries of Latin America. However, when scaling up, there are three important lessons to take into account. First, the program, the brief advice, the training, all have to be very simple and very short. Otherwise, busy practitioners will not be able to get involved and undertake the work. Second, it's vital to keep regular communication and conversations with all of the providers to learn from them how the program is, how it could be adapted, how it could be improved to make it easier to do the work. And third, it's vital to be adaptable and flexible so the program can evolve and change to changing circumstances such as changes in staff, political changes, and indeed adapting to the rather severe mitigation measures that were put in place due to COVID-19.